So when we take x-rays on a child or we're doing an exam and we find that we have these incipient cavities, it's something that will give the parents the option. We can do nothing and we can watch and just monitor, or we have an opportunity to do something that can try and help strengthen this area out. And that's where Phocal comes into play. We explain to them what the process is. It takes a few moments to place the disc. We explain to them the cost, which is relatively inexpensive. And I think that most of them are really on board and they do feel like, yeah, let's do something, as opposed to just doing nothing and waiting and watching. Adding on a Phocal disc is actually relatively simple. It's something that's gonna dissolve in about 10 minutes. We ask them not to floss for that day. Their follow-up is basically gonna just be their next preventive care visit. If we do have a little bit more attention to brushing and flossing and replacing the Phocal disc, I believe that the chances of that lesion progressing to something that requires drilling and filling is a lot less. One of the things I like very much about Phocal is that it is a medicament that can be used to try and treat these weak spots, but it doesn't discolor the teeth. It's not going to cause any problems to the gum tissue. It's not something that we have to place a barrier to. It really is something that can help strengthen this enamel and make it a little bit more resistant to the acid attack by those bacteria so that it doesn't dissolve, so that we're not getting to a restoration. For most parents, the first thing that they think about is, okay, what is this gonna cost me? The nice thing is that this is something that is very affordable, fractions of the cost of a filling or anything like that. Then when they think about, okay, well, how is this gonna be placed? Is this gonna be painful? It's not. It takes a few moments to place the discs. So it really is something that we try and get to them that they can understand that this is a good thing. It's localized, it's relatively simple to place, it's not gonna stain the teeth, you don't have to worry about the gums, cost effective, it's a great product.